Hi, everyone. Thank you so much for joining us. A quick reminder, please keep your microphones muted during the presentation. And if you have questions at any time, you can feel free to submit those in the chat function. We'll take them at the end of the presentation. We're really grateful to have all of you here today. I'm Charlene Lurig, CEO of Texas Water Trade. And we're very grateful to have you here with our partners from University of Texas, El Paso, and our subsidiary Vida Water to talk about the results of a survey we conducted with UTEP across low-income populations of 650 households in 4 different geographies in the state to hear about their perceptions of their water and to better understand how they are closing the clean water gap in their homes. So thanks. We can go to the next slide. I'm CEO of Texas Water Trade. We are a 501c3 charitable nonprofit, which was incorporated 4 years ago to provide water for people and nature, and we work across the state of Texas. Could we go to the next slide? Thank you. So we were formed in 2019 with the purpose of catalyzing voluntary market transactions to make sure that both people and nature in the state of Texas have secure and adequate supplies of water, both today and in the future. And that looks lots of different ways. We'll be hearing today about the work we do with partners around the state related to clean water for all Texans. We do work in other geographies and in other ways of providing that water security for people and the environment. Along the Texas coast, we're buying water to provide for bays and estuaries and the local economies that really depend on commercial and recreational fisheries that require freshwater inflows. In the Permian Basin, we work with farmers and other water users, including those in the oil and gas sector, to try to provide a future of robust economy, both industrial and agricultural, for those economies that rely on scarce water supplies, freshwater supplies, and also to ensure that we can sustain and restore desert springs and river systems that rely on the same supplies of water as do those other sectors. We also are working through our net zero water program in metropolitan areas around the state, trying to create a future and to provide tools and solutions that will allow us to grow our population, to grow our urban economies that rely on fresh water, but to do so in a way that doesn't take net additional water that our other parts of the state are relying on if they're downstream for the rivers where those cities are growing, or if they rely on the same groundwater supplies. And we do that by thinking about and enabling ways that our new building stock can actually source its own water through the water that buildings produce and the water that they intercept. And as we've done that work, it got us thinking that actually some of the technologies and business model solutions that can help us meet that need in metropolitan environments really should be applied and could be applied in the places where Texans today don't have adequate, safe supplies of water. But we also understood that the leapfrog or the leaping of those technologies and business models from those higher wealth, more urban environments doesn't just happen naturally to those who are left behind today. And so if we go to the next slide, that was why we were so thrilled in 2020 to be selected as, please mute. Thanks everybody for muting. We were really thrilled in 2020 to be selected as a finalist in the Lone Star Prize, which was a $10 million prize put forward by Lyda Hill Philanthropies of Dallas. That spurred lots of innovation around the state. And we were able to work through that opportunity with University of Texas, El Paso and some of our other partners to put forward a concept that became Vida Water, which you'll hear about today, and which was responding to the clean water gap that we have known has existed in Texas for decades. And that looks lots of different ways. So it might be the close to 140,000 Texans who live in colonias. These are communities that don't have basic services. Often they do not have basic water or wastewater services. We believe that this 140,000 person estimate is actually an underestimate of the total number of Texans who live this reality, because it is only focused on 6 out of 254 counties in Texas. And many of us who are here today know of colonias in our own communities, wherever we might be in the state. It could be the 1.3 million Texans who rely on groundwater wells, which are not tested, they're not regulated, even if they have constituents of concern that would be tested and regulated if they were served by a public water system. Or it could be those of us who are on public water systems, but who don't receive reliable, consistent service. We may be subject to frequent boil water notices. We may have persistent lack of compliance with other aspects of the Safe Drinking Water Act. And we've been grateful to the Texas Tribune and others who've been covering these dynamics. And we know that as much as 18% of the state's population live that reality, and they tend to be households and communities who are people of color. So with that in mind, I'd like to invite our colleague, Dr. Yvonne Santiago from University of Texas, El Paso, who's going to talk with us about the survey that we conducted with UTEP of 650 households to help us get a better understanding of what this lived reality looks like on the ground, and how people are trying to provide safe water solutions within their households. If you could switch to the next slide, and then thank you, Dr. Santiago, for being here with us today.
Well, thank you, Charlene, and everybody for being here and your interest in this important project for us. If we can move on to the next slide. Our UTEP team has been working in colonias since 2014, and we've worked in colonias in West El Paso, or East El Paso, West Texas, Southern New Mexico, and Mexico in Juarez. And in the colonias, many residents are not connected to a public utility system. So this means that they have to haul water, and they haul water either by hiring this water delivery trucks, they call pipas, or hauling water themselves. And at the time of delivery, the water may comply with safe drinking water standards, but the quality of the water degrades, and many residents make up for this lack of quality that they understand is happening by overchlorinating. So there's a lot of issues with scalp and skin rashes in the communities, and they know they cannot drink this water. So they have to complement with purchasing bottled water, which is more expensive than hauled water, and hauled water is more expensive than being connected to a public utility system. So many residents can travel up to 20 miles just to get to the nearest convenience store to buy bottled water. And so they spend not just the cost of bottled water, but the expense of, gasoline and travel to get this bottled water. So this is the reality of many residents in this century. So next slide. UTEP contracted with local community health workers, also called as promotores, and I'll talk a little bit about them in a moment. But we focused on 4 areas: El Paso County, Lower Rio Grande Valley, Metro Houston, and Dallas-Fort Worth. So you can see here there's 2 rural areas and 2 residential or urban areas that, in the case of Houston and Dallas, they are connected to a safe public utility system. So we did this intentionally for 2 reasons. Number one, to understand how the perceptions of low-income residents in underserved communities, how they feel about the quality of the water they drink, their tap water, and compare those to residents that are not always connected to a public utility system. The second reason is that with the upcoming lead and copper rule, we wanted to understand if residents in these older neighborhoods of Houston and Dallas were concerned about potential contamination from their own pipes. And in general, overall, the water source of all the participants in this survey was 67% municipal and 30% hauled water. But again, each community was different. And for example, in the case of El Paso County, it's 100% hauled water. So that's an important differentiation. Next slide. Our champions in this survey are the community health workers. They're grassroots organizations, and they are people that come from this same communities understand the challenges of these communities and the health issues of these communities. So for us, our partners, indispensable partners are the community health workers. We want to acknowledge some of these partners, the Lower Rio Grande Area Health Education Center in Harlingen, Familias Triunfadoras in El Paso, Bridge for Health in Dallas-Fort Worth Metroplex, Community Care, and Coalition of Community Organizations in Houston. For us, it was really important to partner with community health workers and provide professional development opportunities for them. But also an important aspect of our work is to not just provide education to these communities, but foster potential water entrepreneurship opportunities within the communities, job employment opportunities. And that is one of the key reasons why I work in this, to outlive something that outlives me in this case. We also want to thank our UTEP survey and design analysis team. I know Araim, my student, is here, was key in helping us analyze the data. Ginny Concha, Shane Walker, Alex Meyer, Christy Mena as well. So thank you all for all this work that you've put into making this happen. So now I want to pass it on to Jim. Thank you.
Thank you, Dr. Santiago. I am Jim Dries. I am the inaugural CEO of Vida Water, and I want to walk through some of the numbers behind the survey to really help you understand kind of the reality that we're seeing in this place. And also just to thank Dr. Santiago. Her expertise and passion in this subject has helped us tremendously on understanding the real issues and perceptions people are facing around their drinking water. So next slide, please. The first thing to really kind of mention about is how impactful water is on household economics, particularly in low-income areas on there. And across our survey results, 57% of the households reported that they rely primarily on bottled water as their main source of drinking water. Now remember, this is across 4 different geographies: Houston, Dallas, Lower Rio Grande, and El Paso County. Some municipal, some hauled water. So you're seeing a consistent use of bottled water across a whole bunch of different conditions. The amount people spend on bottled water, well, that varies quite a bit, as you might imagine, based on family size, where they're buying the water. The average came out to $37 per month. And that may be in line with what some people are paying for their municipal water bill in some areas. So this is on top of all of that of paying for water. And just to put it in perspective, that comes out to 2% of the annual income for a household earning $25,000 a year. Now, if you get to trucked water, the numbers are even more striking on the economic impact. So fairly consistently across the survey respondents, the 30% that used trucked water, when they were not hauling it themselves, but relying on a delivery service, they were paying $90 on average. That pretty much is a 2,500 gallon water truck that gets driven from from a water source to their house and delivered at their house. And they sometimes have to give up to a week's notice in terms of scheduling that delivery. So they have to be monitoring their water usage very carefully. So if you look at the average of people, on average, every 3 weeks, they are getting truck delivery. That comes out to over $1,500 a year. And so now you're looking at 5-6% of average household income for folks. But if you take households that have a larger household and maybe they're refilling their water tank twice a month because they have a larger household there, and maybe they're on the lower end of the income scale, then it can be up to 12% of their income or higher just to get water trucked to their house. Next slide, please. So now we're going to jump into some of the numbers here. And what I want to remind people of, these are perceptions. This is exactly how people feel about their water. They may or may not be factually true as we look at these various questions, but these are real to people. This is how they feel about their water. And across all 4 regions, there were some consistent messages that we want to share. The first one on this chart is on the left side, which is my water is safe to drink. And so what you're looking at is the first bar is strongly disagree. 39% of respondents across 4 different geographies and different water sources, 39% said my water disagreed strongly that their water was safe to drink. And so if you look at that, and then you can see the other charts there, but 61% of these respondents either disagree or strongly disagree that their water is safe to drink, compared to 18% who agree or strongly agree. So you've got a ratio of 3 to 1 of my water is safe to drink, which is a fundamental question for people. The next bar chart shows I am happy with the quality of my water. 53% of people either disagree or strongly disagree with that statement. Next, we looked at another question. The taste of my water is acceptable, and similar response. 50% either disagree or strongly disagree with that, and 19% either agreed or strongly agreed. Last question on this slide, the smell of my water is acceptable. And here 43% either disagree or strongly disagree with that versus a lower number that agrees. So you're seeing some real concerns that people are expressing across these various communities and water sources around the trust of their water system. Let's go to the next slide. So given those trust issues, the next set of questions came into what do you worry about? So there's a series of questions for folks. And I remind folks, again, this is not necessarily proven, but this is what people worry about on there. So the first one, I worry about chemicals in my water. And if you look at that, 74% of respondents across these 4 geographies with different water sources have that concern, that they either agree or strongly agree with that statement, versus 14% strongly disagree or disagree. So you've got a 5 to 1 ratio of people who are concerned about chemicals in their water. Next, I worry about microbes in my water. Very similar results on there. 73%, if you combine those 2 bars there, of people agree with that or strongly agree that they're concerned about microbes, versus 13% that disagree or strongly disagree. So very consistent. Lead scored the highest concern, with 76% of people either are worried or strongly worried, agree or strongly agree that they're worried about lead in their water, versus 11% who are not. So that's a 7 to 1 ratio. Again, we don't know whether there actually is lead in their water. We just know from this results, it is a high level of concern. We also know that concern could have nothing to do with the utility and could have to do with the piping that's on their side of the water meter. So that's a reality we need to understand further. And the last question of this series, which combines all of the geographies, I worry that my drinking water will make me or my family sick. And 53%, more than half of our respondents expressed that, which is pretty shocking on there, that is a huge concern. So that's kind of a wake-up call for all of us when we look at these perceptions and trust levels of the water our low-income Texans are drinking. Next slide, please. So I want to break out 2 of these responses, because in some cases there were strong regional differences, and that is due to the regional differences of their water supply. So this fundamental question, my water is safe to drink. So if you look at the 2 graphs on the right, you've got Dallas-Fort Worth Metroplex, and you've got Metro Houston. And there you see a much lower concern. So for folks serviced in the Metro Houston area or DFW Metroplex, yes, there's some concern, but there's also some agreement that they feel their water is safe to drink. So a pretty flat response curve coming from those areas. If you look on the far left in El Paso County, you're seeing 62% of the respondents, these are people on hauled water, are saying they either strongly disagree or disagree that their water is safe to drink. And that makes sense, because if you look at that, they're on hauled water, and there's some fundamental issues once that water is in their tank on maintaining its safety. And then if you look at the lower Rio Grande Valley, you'll see the largest concern expressed across there. 78% of the people we interviewed there, when we asked, your water is safe to drink, they strongly disagree or disagree. In fact, you're seeing over 50% strongly disagreed with that statement. So clearly, more to be learned and discovered is what's going on in lower Rio Grande Valley that has low-income residents that level of concern related to their water. Next slide, please. Next question I want to break out is really looking at this one, which has a strong regional impact. I worry that drinking the water will make me or my family sick. And if you look, clearly El Paso County is showing us a different story. So 75% of people either agree or strongly agree that they're worried that the drinking water will make them or their family sick. And 15% don't worry about that. So you've got a 5-to-1 ratio of people in El Paso County worried about that. If you look at the other regions, you'll see it's relatively flat in terms of it. Yes, there is concern, but clearly something different is going on with El Paso County. So going back to what Dr. Santiago talked about, remember, this is a group of people who is relying on hauled water, whether it's trucked water or water they're hauling themselves. It comes very likely from a very good public water source. We have every reason to believe that. Once it gets delivered into their tank, it's in an unpressurized open air tank. Generally, we've seen at least self-reported poor cleaning practices of these tanks. When the water arrives, residents may chlorinate the water. In fact, often they'll over-chlorinate the water initially. But in these types of tanks, you're exposed to bacteria risk, algae risk, contamination of all sorts. So there's a real reason why they're worried about why that drinking water might make someone there sick. So that's a lot to take in. That's a lot of concern expressed. Again, perceptions of people may not match actual tested water data, but this is our starting point where these people are and how they view their water. So let's go to the next slide. So for us and for Texas Water Trade, this is a call to action. There's clearly expressed concern. We need to go further and deeper to understand that. So Texas Water Trade formed Vida Water, which I lead up, which is a newly formed public benefit corporation that wants to close this clean water drinking gap in Texas. And what will be different about Vida Water as we do this is learnings from past experience is when filtration systems are put in homes, that homeowners don't always know how to maintain them, when to change the filter, what type of filter to select in terms of that. So this really starts out with us looking at these situations and really starting with a water test. And then look and see if point of use filtration can address some of the real concerns in there. So we will start with looking at testing the water and what's appropriate point of use filtration for their drinking and cooking water. So point of use typically under a sink type of system. And then one of the things for these low income areas is what many companies do is there's large upfront costs to start this. And that's a huge economic barrier for families. So what Vida is looking to do is to not have large upfront costs. And in these communities, basically start with a relationship of a subscription service. We test their water. We look and see if point of use filtration can help address their issues. If we don't see issues with their water, we will tell them. If there are issues that point of use filtration is not appropriate to resolve their issues, we will tell them that. And what we want to do is not do that from a distance, but to build out our team from the communities we serve. So if you remember some of the results here, we saw two particular areas of note, El Paso County, particularly those on trucked water, as well as lower Rio Grande Valley, where we saw significant issues. So we will start later this year piloting there. It will start with a test program looking at ways to do effective point of use water treatment to build that relationship of trust. And we will use those community health promotoras and that network to connect and develop much needed water professionals within Texas. And we will monitor their water use and conditions to make sure we can build trust. We can address issues if there are issues, and we can be building trust with that. So this is just a little snapshot of some of the learnings and things we have seen in our response to trying to address this clean water gap for low income and all residents in Texas. And I suspect this generates a number of questions from audience members and others. So I want to open that up, and both feel free to go into chat. You are also welcome to unmute and express a question, and then either Charlene, Yvonne, or I will answer it depending on your question. So at this point, I'd like to open up the session for questions people have.
Jim, I have a question. This is Missy Mandel. Can you hear me?
Yes, please go ahead, Missy.
So you talked about some of the concerns, some of the drinking water concerns of people being on city water systems, but you also talked about the Dallas and El Paso areas. And I'm assuming that those people are not on the Metroplex system, like they're not on the major El Paso water system or the major Dallas water system. Is that correct, or is my assumption incorrect?
Let me go into a little detail, and Dr. Santiago, please add in if something. So within El Paso, pretty much everyone is on trucked water. So they do not have a physical connection. Their source water may very likely come from El Paso water or someone else in that region, but literally those people are getting trucked water. So that describes El Paso as a base.
And Jim, just to clarify for those who are tuning in, when Jim says everybody's on trucked water in El Paso County, what he means is that among those we surveyed in El Paso County, all of those households were on trucked water. Of course, there are many people in El Paso County served by El Paso Water and other water service providers. Just wanted to clarify. Thank you.
Thank you. Yeah, no, that's a very important point on there. If you look at the three other geographies, they are primarily connected to municipal water systems. They may be on the big systems like City of Houston. They may be on separate systems. We were looking for, we did not ask them to report what municipality they were served by. So we just know they're on a public water system, and know that there are 7,000 public water systems in Texas. They range in size from very large to very small. And if you look at violations, they're much more common at the smaller public water system level. Yvonne, would you have any comments you'd like to add to that?
Yes, and the only comment I have is that in the case of El Paso, these are outside of city limits. So that's why they're not connected to a public utility system, and they are miles away from a public utility system. So the solution we're providing might be, we hope it's temporary, but I think in many cases it's going to be permanent because they are so far from the closest connection that I don't think it's economically feasible to connect them to a public utility system.
Susan Lamb, you have your hand up.
Hi guys, I'm actually Catherine Lucetto, but we're from Dig Deep, but we're watching you here together. We're a whole group. There's about 5 of us from Dig Deep. We're excited. This is Kim. She's our research director for Dig Deep. So, yes, hi, how are you, Dr. Santiago? Good to see you again. Very excited about this research and this project. I remember when it was just starting out, let's say last year and the year before that. So good work so far. Just a couple of questions. I like that you all did research in a municipal water service area and also the colonias. I'm going to assume that what area in the county of El Paso? Was it Waco Tanks, or where did you guys do? Where did you choose?
Waco Tanks.
Waco Tanks. Okay, and in Dallas, it was just municipal water, drinking water system of Dallas.
Mm-hmm.
Okay. I was just curious to know. So we've recently at Dig Deep, we did provide water to the Cochrane area, and what we've noticed, and even when I worked at the state as the ombudsperson, when colonias do get water, they still struggle to actually trust that water, even if it's completely safe. So I understand the concept of you wanting to put the point of use systems into the households. How will that trust be built, and what areas are you all thinking of starting with as a pilot? And then I have one second part to the question. Have we thought about, this is something that we've been very curious about, and I don't know how much research is done on it, although there is national research, according to our wonderful other researcher here, Susan Lamb. She's actually Susan. There's national research on areas, people that do not drink their water, even if it's from the tap. So they still get filters, but mostly bottled water is a really big thing. People just trust bottled water. Have you all thought about doing some research in higher income communities where we can kind of see, is that the same level of trust? Will you also be doing a pilot in a higher income community to see if it works in the higher income community as well as the lower income community?
Dr. Santiago, are you willing to take the first question, because about what we might do to build confidence and trust around point of use filtration, and maybe pulling in some of the work that UTEP has done with filtration provision?
Yes, so in the past, we have provided point of use filters in the Waco tanks and other areas in Mexico. We've used them in Ecuador, in Colombia, everywhere. So the main component of trust is you first sample the water before and after. So proving to them that this filtration unit is working. That's number one. And then following up. It cannot be a one-off intervention. So as in the case of our previous experience, what we found is that people are using it and they trust, but when it comes time to replace the cartridges or give maintenance, that's when they totally stop using it, because they don't trust themselves. They don't have this self-efficacy to say, okay, I switched it and now it's working. So providing that service, and that's why Vida Water's challenges is that we need to make sure that we provide this service and maintenance and then sample afterwards. So that's one of the components of trust. And of course, the presence. And I always say that any community engagement work moves at the speed of trust. So it's not something that happens overnight, and it requires presence and consistency. And so that's one of the things that we're planning on doing, and we're starting with Waco tanks first. Yeah, so maybe Jim can talk more about how we're planning to continue the implementation process.
Yeah, Jim, do you want to respond? Because I see other questions coming in. I want to make sure we have time, but Catherine's question on the higher income segments of the market, could you give people a sense of how we want to approach that?
Absolutely. So we are going to be thoughtful in that the primary 60+% of folks that we serve will be in underserved areas. That leaves the opportunity for a 40% ratio of folks that are more affluent communities that, one, care about their water, but two, care about water justice and water equity, and want to be part of a company that believes and services these areas. So yes, we will start in the tougher regions of geography to prove this out, and then plan to expand in areas where we would be open to more affluent areas that are interested in the service that Vida provides.
Thanks, Jim. I saw a question from Marcio Boto in chat. It says, he says, can you speak a little more about sampling in terms of how you select the area and the households? And then for the 61% that disagree that their water is safe for drinking, do they already use any point of use water treatment technology besides the chlorine that has been mentioned? Jim, do you want to start with that?
I will take that in reverse order in terms of that. There's a pretty low percent of survey respondents that are using current water treatment filtration. We did ask that question. It's a fairly small percent of that. So the vast majority do not. It is strictly chlorine. I would invite Dr. Santiago to talk about the area and sampling process. So
we trust our community health workers, and of course we try to collect samples in a random fashion, but really, some of the residents are on to start as soon as possible. So we have already a critical mass of people that want to install a filter. And those people where we install the filter and then they don't trust too much in them because previously the filters were installed based on grants from EPA and the Border 2020 and other federal agencies. And so it was a one-off intervention in many ways. So this provides an opportunity to do something that is sustainable. It's not sustainable for us to come and install the filter and then get grants and come back and review if the filter is working and if the collect water samples. So this gives continuity to the process. So we already have, since we've been working with them for so long, we already have a critical mass. So we'll start with the early takers. And then from then on, what we found in our, the survey had some components of behavioral assessment. So now we understand better what is it that we need to do to change behavior of people. Too much to discuss here, but that's one of the things. If we have a critical mass of early takers, that creates a snowball effect to add more subscribers to the So that's one thing.
Thank you. I wanted to respond to some of the discussion in chat, which is great. And then I see Carolina Cuellar has a couple questions, so I want us to respond to that. But the folks at Dig Deep said in chat that they recommend that Vida employees actually subscribe to their service, which assists in building trust. And we couldn't agree more. We do know that because this is such a labor-intensive model and one that you have to build in a way where you know you have enough workforce personnel to respond to the challenge within a reasonable amount of time, that we will be building out in specific markets. And so Vida personnel who are within that service territory where we can meaningfully deploy absolutely will be encouraged to be on that subscription service. I'll comment, having met some of the folks from Dig Deep, including the founder, George McGraw, several years ago. They've been doing phenomenal work related to providing safe and affordable water services across the United States. And one of the things that spurred us to look at developing Vida in Texas was actually having seen very similar circumstances in the Central Valley in California, where you have primarily farming populations, farm workers who don't have safe groundwater because of nitrate leaching into the groundwater table. And one of the things that we observed there was that there was not a comfort with decentralized service provision being the means to provide the safe drinking water, which was not necessarily because the technology couldn't get you there, or that it wasn't more cost effective and therefore more realistic, that the problem could be solved at the point of use compared to waiting for centralized treatment systems and pipes to be extended, but that there was a perception among those households that they wanted to have the same centralized service that more affluent households had, that somehow that was preferable from a safety, affordability, kind of basic human dignity standpoint. And that's one of the reasons why when we designed Vida, we wanted to design a service provider that would be serving higher income households with the same services alongside lower income households, to try to create some sort of trust and perception of parity between different economic strata among our customers. Because we do know that decentralized services are going to be increasingly important and effective and necessary for all different types of user groups in different geographies and economic realities. So I appreciated that perspective. Carolina Cuellar had a couple of questions, one of which should be for Jim, I think. She wanted to understand what the pricing is expected to be for the monthly subscription service, how that compares to average monthly water expenses in Colonias. And then she also wanted to know if the survey was offered in Spanish. I can answer that part and say, yes, it was offered in Spanish, which is very important given the communities that we hope to serve. So Jim, can you answer Carolina's question about the pricing?
Yeah, absolutely on there. So our target from the start was to look at what people are paying for bottled water, and that was the $37. So that gives us a target price point that we want to be in the neighborhood of. We're going to pilot the service because we have to understand our cost structure to make sure that this is a sustainable activity for us. And that would provide basic level of filtration. We do think that some issues, so think of a cartridge type or multiple cartridge type filtration system becomes a basic initial offering for areas that may address a lot of water issues. For some folks, depending on what contaminants are in their water or how much they really want the water to taste like bottled water, may have to go with a reverse osmosis RO system. And there would be, you know, at a say a 30% higher price point on there based on how we have to spec out the system. So I think there's still learnings for us to do as we enter this marketplace on what's a pricing level that works for folks. The goal is to put no more economic stress on these low-income families on there. That puts the burden back on us to come up with very effective filtration that we're efficient at delivering, which is why we really need to partner with the folks that are in that community. That can be our service force, our sales force. They have the trust, which is huge. So that's who, so the natural evolution for us is these folks that did the surveys, that have the trust, that we continue to work with them because they're very interested themselves in helping address these issues for their community.
I'll just make one note, and Dr. Santiago can say a lot about this as well, which is, you know, when we talk with communities and households about what they're paying for the water that they secure, that's only looking at the out-of-pocket expense for buying that water. If it's trucked water, buying the water, if it's bottled water, it doesn't take into account, as we said earlier, the transportation costs, the time spent. Certainly on the hauled water delivery side, you know, it's not uncommon. Even here, I live in Austin, and in Travis County, we have households that do not have water services, and every Saturday will drive their tank in the back of a pickup to a standpipe operated by Travis County and Austin Water to fill up that water tank. That may become that person's Saturday, their leisure day. One of their leisure days is spent filling up water. And so we're very interested in eventually how Vida may be able to think through improving logistics, even on the hauled water side of things. But we need to, you know, consider this isn't just out-of-pocket expenses that people see associated with their water. It's all of those other economic and quality of life factors.
And just to add on to that, Charlene, is to say, also keep in mind that what people are paying for bottled water does not mean they're doing a sufficient level of hydration. And that's something we've learned a little bit from health promotoras, is folks that are in water-stressed areas may be underhydrating, leading to other health issues. So more to be discovered there. But, you know, I don't know that, I mean, part of that hope is that if the cost is there and the incremental cost is really nothing to them for drinking more water, that they do drink a healthier amount of water. Dr. Santiago, any comments?
Yeah, I just want to emphasize the other health issues associated with not just quality of water, but quantity of water, right? I mean, during the pandemic, there were many health issues in colonias because, you know, you're supposed to have better hygiene to prevent getting COVID. And so we found connections with people that have diabetes or kidney issues, right? They have to drink more water, but they're not doing it because it takes effort. It's not just out-of-pocket expense, like Charlene said, that it takes effort to go get water that for drinking. So it's more than that. So there's many repercussions to water scarcity and lack of good, safe drinking water.
I see a good question from Jim Edwards. He asks, what is the Texas Water Development Board doing to improve water services for inadequately served persons, such as those that we've surveyed? So the Water Development Board, for those of you less familiar, they're the state's science resource agency, water planning service, and also our water infrastructure bank. So they fund water infrastructure projects, drinking water and wastewater across the state of Texas. They have a program that is only occasionally authorized and reauthorized and refunded by the legislature, called EDAP, the Economically Distressed Areas Program. And so this is a fund that was created by the legislature some years ago, is not available every single year, again, because it requires the legislature taking the step of affirming reauthorization and refunding of it. I believe that also then has to go to voters to approve. But it is for the last biennium, I think they put forward $200 million into that fund. It is exclusively for first services, either on the drinking water or wastewater side of things. So these are communities or schools that have no water or wastewater service, providing that service often, but not exclusively, by extending and connecting them into an existing water service provider. We are really encouraged by the commitment of the Water Development Board Chairwoman, Brooke Popp, and other members of the board in trying to get those funds deployed. They just had an intended use plan this last year. I believe that there is a plan for the remainder of that funding to be fully expended, and it will be up to the legislature to decide whether or not to reauthorize and refund that. And again, there might be others on the call who can say with absolute clarity, I believe that that ultimately will go to voters. So if you vote in the state of Texas, and that is something that comes up this fall, of course, you know, that's an important thing to consider. We know there are many communities who will not get that EDAP funding, either because there aren't the right people within those communities to be aware of the process, to champion the process, to work through all of the mechanics of getting through that funding round. It's very important if you are a participant in councils of government around the state. That's one of the ways that we have seen some communities get projects put forward into the intended use plan for EDAP. But we also know, as Dr. Santiago said earlier, there are many places around the state of Texas where it is not likely that communities will be hooked into existing water services because they might be 13 miles away from the closest line that is served by a water system. They might be outside of that water system's CCN, which is basically their regulated territory to provide. And that's part of why we wanted to create an option that could help people get water in those places as soon as possible, rather than waiting for the development of a public water system to be created. We also know and have spoke to people who Dr. Santiago has worked with and provided filtration for, that sometimes the cost of actually extending from the water main to the person's tap may be more than the value of their home. So it's not unusual for just that extension of that line to cost $40,000. In some instances, utilities will incur that cost themselves. In others, they won't, and it's on the homeowner. I think Dig Deep recently paid for that cost for the Cochran Mobile Park in El Paso County. So that's a wonderful example of where philanthropic funds can be brought forward to pay that connection. But I hope that gives people a sense of the limits of what EDAP and other funds can do.
If I can add to that comment, Charlene, that some communities do not qualify for EDAP because there's no development plans. The county specifically has not put the effort into saying, okay, let's try and provide some sort of development so that they can qualify. And that takes humongous amounts of effort and funding. So some of these communities, like in the Waco tanks, they just do not qualify for EDAP funds.
Right, that's right. And I Dig Deep folks, I see a hand raised again. Y'all want to turn on your video and ask your question?
It's me again, guys.
Hi.
I just wanted to put it out there that I think we're all going to be doing some work in Waco tanks now and in the future. So I wanted to see if Dr. Santiago, and I'll put it out to the group as well with Charlene and Jim, if we can make a time to meet so we can discuss what we're going to do, and maybe we can find a way to work together in that space.
Absolutely. Okay. Yeah, no, and look, I think that's the follow on to the EDAP is to really address this issue fully is going to take EDAP system level, utility level funding. It's going to take extensions and programs like Dig Deep does. It's going to take point of use filtration. In some cases, the point of use filtration will be a bridge to a better solution that comes in a few years. In other cases, it may be a community that realistically may not have the service they need for a long time.
Yeah. And guys, I also wanted to let you know that Dig Deep has done a feasibility study, which is currently in review with the County of El Paso and some of us here at Dig Deep to provide comments back. We did a feasibility study for Waco tanks. So once that is complete, we can also present that and work together to see. So what we want to do is plan out a water source at some point. So yeah, there's a lot going on, and happy to partner and
yeah,
work
we
together.
can share another report with you as well, but I just wanted to make a comment that many of these communities lack civil infrastructure, but also lack social infrastructure. So it's really difficult for the community to come together. There's no community centers, there's no place for them to meet. And so I think that that's another thing that people can do with their councilmen or commissioners to provide some sort of infrastructure so the community can come together. Because when we meet in the colonias in Waco tanks, we have to rely on a person, and we bring 10 people at a time, and we have to do it many times in order to engage a good number of people. So the social infrastructure is also important.
I also just saw another question come up from Marcio about type of filtration and yes, pressure. So yeah, every type of filter is going to take some type of pressure differential to move across in terms of that. And the highest requirements are for RO. So that will be one of the evaluations. Is this effective? Is to say, doesn't have sufficient pressure. So some of these water tanks may be gravity fed. Others will have pumps there. As you look at micro and ultra filtration options, each one of them kind of has a sequentially lower level of pressure requirement. But there may certainly be cases where a household does not have the pressure needed for an effective filtration system. And so then we will look as what are all their alternatives that might be able to be done in terms of that. So yeah, that's a concern almost house by house to understand those on that.
Yes. Just one more last thing, guys. Dig Deep is planning to apply for a grant through the EPA where we can do just what Dr. Santiago said, to bring all of the different parties together. But even if we don't get the grant, that is something that we are wanting to do right now, because there's also, as we talked about, different socioeconomic classes. We have found that in Waco tanks as well. And Waco tanks is the name of the colonia. But in Waco tanks, we found different socioeconomic classes, and there is a group there that already has a neighborhood association, but they don't necessarily represent the entire area of Waco tanks. We want to work together to bring everybody together towards a common goal. So we'll speak more for sure, guys. I'm going to be a pain in your side.
No, this is not a pain. This is needed.
Well, and I think to serve these communities, it is the question of what's the right solution path. And I think we're going to have a lot of hybrids because also some of these colonias are much smaller in size than Waco tanks. I mean, we talk about it because it's a large community of 300 to 400 families. But as the size of the colonia goes down, the economic challenges get harder.
Exactly. Are there other questions? This has been a wonderful discussion.
If there's no questions, I have one comment that
Thanks.
So I really feel blessed to be able to work with Texas Water Trade and Vida Water. This is the opportunity of a lifetime, as I mentioned before, that we're able to come up with an alternative to these communities that would never be connected, that the Culligan filters, the big companies would never go into these colonias because it's not economically feasible for them to go there. So I just want to acknowledge and publicly the report from Texas Water Trade and Vida Water that make this possible. So thank you.
And same to UTEP, who helped us kind of really co-create this concept, which we're honored to be able to work on and do it alongside other great philanthropic organizations like Dig Deep. We know that for every one Waco tanks where we might be able to collectively put in some joint elbow grease and deliver solutions. I mean, I fear that in my lifetime, we will never stop discovering communities who live in similar circumstances, some of whom may have no water services and others of whom have water services that are not functional in any way, shape, or form. And just to put a finer point on that, Jim mentioned earlier, there are 7,000 water systems in the state of Texas, many of them very small. there are roughly 7,000 licensed water operators in the state of Texas. And you can imagine that, city of Dallas, Austin, Houston, they don't have a single water operator managing their water treatment plants. They have multiple. So many of these communities have less than one person who's skilled. There's some statistic like nearly half of that workforce is anticipated to retire in the next 5 to 10 years in the state of Texas. This is at its core, not just for those of us who don't have reliable drinking water, but even for those of us who do have safe, reliable tap water today, a massive workforce challenge. And that's another area where if you happen to be part of an organization that is thinking about the next generation of the water workforce or the labor workforce, ways that we can to be cooperating with each other and elevating the need among decision makers, and then creating solutions that bring that workforce forward. Otherwise, none of the things that we talked about today, centralized or decentralized, will be effective. So we thank you so much for your time. This will be recorded and we will post it to our website within the next day, I believe. So if you didn't get the chance to listen into the whole thing, you missed something, you want to tune back in, or you'd like to share with a colleague, just please know it will be available. And we're so grateful for all of your time and for the support of Lyda Hill Philanthropies and the partnership of UTEP. Thank you so much. And we wish you the best in the rest of your day. Thank you.
Thank you, everyone.
Thank you.